I have found that in my work that what was essential was to incorporate a table like the Manuthera. Before I knew of their existence, I used an old Chattanooga, which had rotation, some lateral bending, but it was so archaic and just had, it just like moved in a ratchet-like sense. What attracted me to the Manuthera, while I was at a conference in Germany, I met a doctor who had basically 8 of these tables in his office. He was an orthopedist. He treated athletes from all over the world. I stayed with him in his office for a week and just reviewed with him the table and also going other techniques that he had utilized. And I just said, I have to get these tables into my office. I'm very happy and excited that we're able to help our patients out with the table. So let me just go over some of the details with what it can do for you and why you should get one for your office. Okay, one thing that's great about these tables is that they have, well, number one, 2 motors, which allows us to position the individual in the most comfortable position, not just for the patient, but also for the treating doctor. So and the other nice thing about these tables, too, is that they have foot level switches, so you don't have to bother using your hands. But the one thing I do like about where you have to use your hands is that everything is basically manual in terms of your flexion, your extension, your lateral bending. And what I like about that is you get to control everything. I wasn't really attracted to getting just a regular traction table where you hook the individual up, walk out of the room. Here you really have to be right with your patient every step of the way. For instance, if I was doing some flexion extension for the lumbosacral joint, as I'm moving through my flexion extension, I could just take it to the exact degree to where the individual feels comfortable and just where I'm feeling some opening up. I could then even direct by pressing the lateral lever, and I can move into one side and I can perform the treatment at the specific joint that's affected. The other nice feature about this table is that you can also do rotation. Everything locks so nicely, so when you position the individual, everything just stays stationary as it should. So while you're doing your rotational movements, and what I would recommend is you could actually, for your own spinal health, is to bend into this as you're moving this. Here you could really palpate and feel exactly what's going on in the spine. I find that before I'm even going to start to do any of the vertebral manipulation, high velocity, short lever movements, I'll mobilize the spine first. So these tables are great for any type of musculoskeletal disorder. I also find them very effective with lateral disc herniations, where you could position the individual into the specific line of drive and then just gently do some traction or flexion. Next, we'll do some traction on here. You just simply pull out the lever. To the segment, you're going to apply traction. You could take your other leg and you just gently glide this out. And they also have straps if you want to do some gravitational traction. Now the patient's secured to the table. Create some clearance. And from this position, I can now do my gravitational assisted traction. I could even get into the thoracic spine while I'm doing this. And this gives me great access where I don't have to have the individual keep on standing up, sitting down, motion palpate. I could do everything all off the table, and then obviously treat from here as well. And I'll just show you some of the circumduction that can be done as well. There's another lever here for the thoracic piece that allows me to move in the sagittal plane. So with the rotational component in here, I could also get some circumduction, so I could even achieve greater range of motion. And you know, while we're treating the lower back, it's so important not just to treat the affected segment, but the surrounding structures as well. So here with a tool like this, you're able to do this. The other thing that works great in mechanical disorders is that if you're going to be doing any type of adjusting, I find that this preps the body in such a way that most of the segments where you might have initially found that were restricted, they start to open up. So in general, I find that the patients hold their adjustments much better. You're able to position the individual into a much more relaxed state, so you could really get in there with your line of drive without any interference and make your necessary treatment. Great thing about the headpiece, the cervical headpiece, is most tables you'll find that they basically pivot just at the proximal joint. In this particular unit, by just depressing these two levers, I'm able to lift up the headpiece, keeping it horizontal to the floor. And this is a much more desirable type of positioning, so the individual could relax in a much better state. With doing side posture, utilizing the lateral movement of the table, you could position the joint to be adjusted at the exact specific angle. And while you're in this position, while you're palpating, you can utilize the foot pedals, or the foot bars, just to get the exact angle. So for instance, the back lever will control the tilt. So if I need to get a higher tilt, just to get this joint to open up in a more favorable position. What's nice about it, you actually feel the body starting to relax, so you know exactly what you need to do. If you need to just, lower the height, and then you could do your adjustment. Also, at the same time, if you find that the individual is more comfortable if they're curved towards you or away, if I needed to get a little bit more extension into that spine, you can do it like that. And then you can perform your treatment in a much more comfortable position for the patient. Next, we'll go on to the cervical spine. They also have this little wedge piece, just lift up, so this way the head will sit in a more comfortable position. You can come back up. And when the patient is lying supine, you want to try to reduce that forward neck flexion. This way you can get right into the cervical spine, and you can do all the necessary palpation and treatment if you do muscular work as well. And here, I always like to keep my thigh in contact with the headpiece, and I like to use my legs a lot. This saves my back. And I could just come in, I could just go through the mobilization, and you can get a really good assessment of the various different fixations. Okay. Okay, the next thing with traction of the cervical spine. Also, I just wanted to point out too, the table can be adjusted per the height of the individual. Just by releasing this lever, we could then bring out the cervical segment. I could also do the same with the back while we're doing traction in the lumbar spine. So this way the individual will feel comfortable on the table. So with cervical traction, I'm going to just release this lever. We're going to get the headpiece just so. Just center in here. And when I perform the cervical traction, I'm going to make my contact on the fixated segment, and I press my forearms into the headpiece, and there I could just glide my body back while I'm taking the offended segment here at C2, C3, and just applying the right amount of traction. If I wanted to get some more traction on the cervical spine, let's say someone wasn't experiencing enough traction, I would just tilt this slightly. If I needed to strap him in, I'd strap him in just to secure him, but in this case it won't be necessary. And the other great thing too, the height with this table allows you to keep your back in a much better position. So again, this table is for our patients, but it also is a wonderful tool that we get to utilize and not strain our backs. Next, we'll do the shoulder, since I have you in this position. Okay, the arm pieces on the Manuthera are great because they move in 180 degrees and they can be lifted up or down. So for treating shoulders, I find these very effective, especially with adhesive capsulitis. While I'm holding onto the arm, I disengage the lever here, and I'll work within the pain-free range of motion, and I could cover all the anterior muscles, the pectoralis, the deltoids. When I need to do any type, excuse me, just one second. If we're going to do some work on stretching the back muscles, these arm pieces can also be adjusted to the length of the individual's arms, so you can come in here. What I like about this is that you don't need to get any other type of device to work on. Everything is just coming right from the table. And here I can control everything I'm doing. I always secure the arm piece because this is movable. It doesn't lock. It only locks at the two extremes. Then I could do my muscle work, opening up with internal, external rotation. I could do also work on the subscapularis. Sorry, Shannon, let me grab you a little too much there. And I could also apply traction into the humerus while I do this. And it's just a much more control can be established, as opposed to not having anything holding the arm, grabbing it, which I've done many times over the years with other tables. This just makes it much more comfortable for myself as well as the patient. And you could also work the anterior ligaments of the shoulder when the patient is in the prone position. So here I have the ability in the prone position to elevate or lower the arm. Usually when someone's coming in with adhesive capsulitis, their arm is in a contracted state. So having that ability to move into different position allows me to work in a more comfortable position. Then from here, I can, having this space allotted to me, I could work the front part of the capsule, and we could just make adjustments as we need to, elevating or lowering this. Okay. The other piece on here which we didn't go over is the drop. What I like about the drop is that it is direction in a caudal, and let me just get this disengaged. Okay. And it also allows you to do long axis extension. You position the individual slightly in an extended position. you're just going to slide down over the spindle of the table in the offended joint. You cock the table into position. Let me just come from this side. And then just with you don't want to lift up on your thrust while you're doing the drop. It's just a quick follow through. And again, you can position, depending on the patient's weight and body type, just by elevating or lowering the table, just to get the proper amount of traction. It's a very nice, gentle type of drop. It's only present in the lumbar spine. And the glide on here, that's something that I really wanted to drive home, especially coming from the old Chattanoogas that were so ratchety. The glide on here, once you got to get to feel the table, so you get to understand what I'm talking about, because it feels like there's nothing between you and that articulation. So when I just shift this lever, it just glides just so smoothly. You could just get on here and you could assess all the different movement patterns that are taking place. Just to review again, the rotational component, I don't know if I was on the other side, but just to show you again that what I do is I press my thigh up into the table, so now I have complete control. Also, by keeping my own back straight, I'm using my leg muscles, and I could get in here and I could assess the rotary component of the lumbar spine. And you go right into treatment after. If you're doing any type of myofascial work, you do your myofascial work and follow through with the movement. I really find that has just been such an important asset in my arsenal for treating patients. So as you could see, I don't know if you watched any of the other videos that are out there with the Manuthera. It just has a really, I find it has a really wonderful continuity, excuse me, I'm just trapped here, in the whole treatment process. So I typically find that I'll first evaluate the whole range of motion, passive, active. Then when I'm getting into checking for any joint fixations, we're going to go through a whole motion palpation. Now I find I could just have the individual lay prone, and I'm able to do my whole assessment and do my treatment with, in my case, I'm doing acupuncture and fascial manipulation. And the tables aren't comfortable enough, even though they're designed to do manipulation, but I've been finding even if I'm doing like a 45-minute acupuncture treatment, that they're comfortable enough to lay on for that period of time. And of course, you could always adjust the table to your patient's liking. And you'll find as you're working with someone, let's say you get a patient, they come in and they're extremely restricted with low back movement. You might start working on them with the table more horizontal. As you're starting to do your work in the affected area, as you know, the back starts to open up. That thoracolumbar fascia will open up. So here I could just accommodate that in this fashion, or if I'm finding that we're dealing more with thoracolumbar issues, I will then, there's a lever under the second panel of the thoracic piece that allows me to move in the sagittal plane, so I can flex that forward just to get a little bit more range of motion, and then I can go back to working the lumbar piece. Just disengage the flexion unit here and the lateral movement, and then I can assess the movement of the ribs coming on the spinous process with a flat hand connecting with my pisiform. You get a really good feel for what's happening at the motor unit, and then make your necessary adjustments. With a Cox table, you're going to have a lot more automation, like Bob says. But with that, I have found that with some of the other tables that I had, the more automated tables, that they were much more costly to run. Now, since 2010, I had the first model of the Manuthera, and I spent literally $0 on maintenance. Zero. I was able to do everything myself. I think I had to replace a piston on the cervical headpiece, where the pistons on the cervical headpiece allow to get this flexion and extension movement on here. And it was just a matter of simply just taking a pin out of the shaft, screwdriver, and putting it back in. I put a call in. This I called Lawyer directly. They sent the part over, and it was no issue. And I can't tell you, I'm sure you gentlemen also have found the costliness of what the uptake is on taking care of a table. And this, literally, since 2010, I have spent $0. And the other thing, great thing, is that these tables have kept working. There have been no issues. You don't have to like put the table to the side because it's not working. I go to visit some of my colleagues, and there's always a table that's laying there in repair and then waiting for the repairman, and it's so difficult to get a good repairman. You know, I'm not that handy, but these tables are so simple to upkeep on. And that's another thing to consider when purchasing. In addition to what I find to be just an irreplaceable tool. It allows you to do so much more. I do like the Cox tables, but I have to say the automation part of it is not something that I was looking for. I just feel I have so much more control when I'm working with a case by having everything manual. Other than the fact that having these two motors where you can position and angulate, let's say if Shannon was complaining of like some sinus difficulty, we can just simply, while we're in the prone position, just tilt this up ever so slightly just to take the angle off there so the sinuses will drain much better. When, as you know, when you're treating someone, if they're more comfortable, you're going to have a much better outcome. You can really bring out the affected lesion. For instance, if I'm working in Shannon's lumbar spine and the tissue is just so constricted, because even in this slightly flexed position, if I just go into some slight extension, I could relieve some of that tension. And then by just throwing in some lateral movement in here, I could actually get right onto the fibers. And this I really found very effective. I do fascial manipulation, so I'm looking for a densified point, a sclerotic point, a fibrotic point. And I have to say that after going off like a flat bed to coming onto something where I could adjust that into the proper position, and let's say I found it in this particular case, I'm really bringing out that fascial density, I will just lock the table into position and I could just do my work in a comfortable position. And having the ability to tilt the table up or down, not even thinking about if you're going to do gravitational work. You don't even have to do that. That's just like an added luxury to have while the patient's going through their rehab. Just having all this minute little angulation to change and shift, it is so, I can't tell you how, whoops, I'm sorry. I shocked you there, Shannon, sorry about that. I could get right into the proper posture and do my work. And the other great thing about it is that you could go back and you motion palpate. You know, you do your work, and I think it's actually better, which I find in my practice, that after I do some fascial manipulation, might do a round of 5 points, I'll go back and do some range of motion, and the person will we could actually tell if we're on target. The range of motion should start to improve, the tenderness should start to come down. Overall, we should see some type of a progress. And if I'm not seeing anything, I might go back onto another plane of movement. Maybe I just got the wrong one. So this I could correct my path and line of treatment all in one. So thank you for the opportunity to demonstrate the Manuthera 242.